Hello and welcome to Two Docs. In this video we're going to talk about wrinkling of the retina, a fairly common problem, kind of like wrinkling of the skin, but inside the eye. The main result of that is reduced vision. If vision is reduced enough, it can be fixed by a delicate surgery, which we will show you in this video.
Hi, I'm Dr. Patrick Monahan.
And I'm Dr. Craig Blackwell. Together, we hope to show you a number of fascinating things going on in the eye world, using diagrams, photographs, and video of actual surgery. To get you oriented, here are the main structures of the eye. Lining the inside of the eye is a layer of nerve tissue called the retina, which acts like film in a camera. The vitreous is the jelly that fills the hollow space in the center of the eyeball. It is much the same consistency as egg white. Now, let's rotate the eye and focus on the area of central vision, the macula. Here we have isolated the back part of the eye. This is the area of finest detail vision. An OCT scan shows us this part of the retina in greater detail. Note the smooth hill and valley contour of the central retina. As time goes by, changes in the vitreous can cause a number of problems in the eye, including wrinkling of the retina. The wrinkling comes from a membrane laying on the surface of the retina called an epiretinal membrane. The membrane has a tendency to contract, and since it is attached to the surface of the retina, that causes the retina to wrinkle. Here is a case of just such wrinkling. Vision is reduced to a little less than 20/40. The remedy for this is surgery to remove the surface membrane. This is accomplished in 2 steps. The first step is to enter the eye and remove the central vitreous, which we have described in another video. With special, very fine forceps, one can delicately grab the edge of the membrane, peel it off the retina, and remove it from the eye. That allows the retina to smooth back out, hopefully improving vision.
Okay, Craig, I think we're ready to take a look at the surgery itself. First, this is a picture showing the surgeon's view. You can see the optic nerve where the retinal blood vessels come in. You can see the macula, which is the center of the retina, and the fovea, which is the center of the macula. When we look at the patient, the cheek is down and the forehead is up. This fades right into surgery here, where you can see scleral ports, these blue cannulas, have been placed into the eye so that we can enter with instruments. This is a 25 gauge surgery, and there is no cutting on the eye, just these ports being placed. The lens is placed on the eye so that we can see into the back using a microscope. A small infusion port was placed inferiorly and we're going in with the light pipe and what they call a vitrector or a cutter. Here you can see the jelly inside the eye is bouncing around as the cutter is literally sucking on it and cutting it and removing it. We have to clear the vitreous jelly first before we can get down to the macula. We don't want to pull on the vitreous jelly because it will cause a tear or break in the retina. So first off, we clean out the central area. You can see at this point there's a skirt of vitreous 360 degrees still left around. We just clean that from the central area, and we'll deal with that later under a wide field lens system.
So Pat, patients ask, my vision in this eye is pretty blurry and distorted. Why did this happen to my eye?
The cause of the epiretinal membrane is actually from the jelly in your eye. The jelly normally turns to liquid in your eye and then peels off your retina, as you explained earlier. Unfortunately, sometimes that will leave a little remnant. In this case, you can actually see the optic nerve over to the side, or you can see the blood vessels coming out there below, then you can see the optic nerve, and now you can see the macula. On the macula, a little piece of the jelly got left, and hence it then gets invaded with white blood cells and fibrocytes and sometimes contracts and causes distortion of the vision or decreased vision. What we're doing at this point is we are cleaning the vitreous around the macula before we actually go in on and grab the membrane itself. We do not want to pull on the vitreous, as I said before. So we're now going to change instruments and remove the vitrector from the eye and go in with a little tiny pair of forceps to actually engage the membrane itself. You can see that these things are quite small. They go right through the little port there, and we'll now try and engage the membrane. So again, we don't want to pull right on the central foveal area. We want to stay out of that. So here we are engaging the membrane, and you can see it's starting to lift up and pull back. And I think I'll show it to you a couple times here. You can actually see it there. And it comes off in one nice piece in this case. And you can see this is pretty mild, pretty translucent, pretty difficult to see. Fortunately, our view in surgery is much better. And there you can see it, and then we remove it from the eye. And it's that simple to remove an epiretinal membrane. I'm showing another case here. I put this in because I wanted you to be able to see the membrane being peeled easier. This case, there was a little blood on the membrane. This is from a diabetic case. And you can see that membrane being peeled off in one large piece and coming out. And that's it. It's removed from the eye. So it's not too traumatic to the eye itself to get that off of there. Once we've peeled that membrane, we then go back into the eye, clean up, and make sure we're doing a little suctioning right here to make sure there's no remnants of that membrane.
Pat, now, with the membrane gone, how much improvement can I expect in my vision?
It should improve. There's two components to improvement in your vision. First off, you want the distortion to improve. That's more important actually than the actual visual acuity for most people, because it allows the two eyes to work together. And with that epiretinal membrane and the distortion you might have, you often end up with the two eyes not working together very well until that distortion goes away. What we're doing here in the video now is we've gone to what we call a wide field lens system, and this lets us see not only the center but also the more periphery of the retina. You can see those two dark spots. Those are actually under the retina. They're small birthmarks and are not uncommon in the eye at all. So now that we've cleaned the vitreous out of the center, we want to go around the edges and clear as much of the vitreous as we can, because we don't want the vitreous to stick to any part of the retina it's not supposed to and cause a retinal break or tear. And this is a good way for us to go around and clean up as much of the vitreous using the wide field lens system to clear that and keep it from pulling or tugging later. This also allows us to look at the peripheral retina quite closely at the time of surgery and make sure that there are no retinal breaks and tears already present or other lesions that might be problematic for us.
So Pat, when this is done, how long before I notice an improvement in my vision?
Oftentimes people will notice an improvement in the distortion of their vision within a couple weeks, certainly within a couple months. You have to remember this is nerve tissue. It didn't get like this overnight. It doesn't heal up overnight. I've seen people improve for a good 6 months after this has been surgery has been performed, and even up to a year where they get before their final improvement. The only downside to doing the surgery like this is that it causes cataract to progress in almost all cases. If someone's already had cataract surgery, they don't have to worry about that. This is just the final cleanup here, and then we'll be pulling our instruments out. Once that has been performed, we will usually then go ahead and remove the ports, and removing the ports is actually quite simple. You just grab it with a little forceps and use a Q-tip as you pull it out and push the conjunctiva over it, and just push for a minute, and that just closes up the small hole. The surface of the eye will usually heal up within 1 day. We usually patch these eyes for 2 to 3 days just to make sure that the pressure comes back to normal. Now you can see the pre-op, post-op after about a month's time, and then post-op after several months.